Hey, Allie, let's talk about something uncomfortable today. Have you ever peed your pants when you're laughing or jump rope?
Shauna, you're about to make me do that right now. Thank goodness we have a pelvic floor therapist on the show today, Miss Jodi Brown, that is going to help us find out how to not do that.
Before we dive in, let's give a shout out to an avid listener and hype girl, Maureen Ing. Thanks for all your support. Let's get to Jodi.
Welcome to the Girls Talk Healthy Aging podcast, where we dive deep into pressing health and fitness issues facing aging women. I'm Allie Kerr.
And I'm Shauna Kaminsky. And together we'll bring candid conversations, expert advice, and personal stories that will inspire and empower you on your own wellness journey.
Shauna, I'm so excited to introduce our guest today, who is Miss Jodi Brown, who is a pelvic floor therapist. And as women, who doesn't need a pelvic floor therapist? So Jodi, thank you for joining us and welcome to the Girls Talk Healthy Aging podcast.
Thank you.
We're going to dive right in. Shauna, go.
I was just going to say, let's just start off by defining what the pelvic floor is. Can you share about that, Jodi?
Yes, the pelvic floor is basically your pelvic girdle. It's a series of several muscles that create the pelvic floor. Those are more internal muscles that contribute and help with bowel and bladder function. They help with balance. They help with the lymphatic system, so moving fluids. They help with life, so sexual function, childbirth, and all those sorts of things. I mean, I consider the pelvic girdle those internal muscles, but you can even consider sort of the external muscles like the glutes, the low back, the core. Those still need to be considered pelvic floor as well.
So give us some things that we need to consider when we're thinking about the pelvic floor as women. Like, how does it affect us? Why is it important? And then you talked about some of the things that it does, but what are some of the dysfunctions that we have?
Absolutely. So the first ones that come to my mind are bladder incontinence, urinary incontinence, so bladder dysfunction. So what that can look like is if you try to run or jump, cough or sneeze, you might leak urine. Some women will say that they leak urine on the way to the bathroom. Another type of dysfunction can be constipation or bowel incontinence. And then another big one that I see in a lot of women who are trying to exercise is a lot of back pain or hip pain or pelvic pain in general.
And we may not recognize that could be, who would have thought that could be the pelvic floor causing all that? How does that affect back pain?
Actually, it's funny because a lot of times when you have bladder dysfunction, you have back pain. So they're sort of best friends. I say they kind of follow each other around, and it's a muscle dysfunction. So everything's connected. So when maybe your internal pelvic floor muscles aren't working properly, that can travel sort of up and create back pain. It could be from either muscle weakness, muscle stiffness, or just a general poor coordination between the muscles not working together.
So, what can be done? I have a client that was so excited that we were talking because she has, and this is, I'm wondering if this is common, that after her first child, she was a very avid exerciser. And then after her first child, she had an episiotomy. And in her recovery and postpartum, she just got increasingly more debilitating back pain to the point that she can't exercise. So, is this a common thing, and what can be done about it?
Great question. I think it's very common. I think it's probably more common than we realize. And the great thing is we're starting to talk about it. So, pelvic floor dysfunction can happen at really any age. What I find, and I think a lot of times what happens is when we start having babies, because those muscles and the way the baby's growing within our bodies, it shifts everything, it changes everything. The muscles become laxed, and then everything sort of shifts. So what I find a lot of times is what we can do, and now that we're talking about it more, is ask, ask your provider, hey, I'm hearing about pelvic floor therapy and I think I'd like to try it. So sometimes if we're really struggling with regaining that function, some women will get better on their own, and that's wonderful. And then other women will have a little more struggles, or maybe they have that lingering back pain or hip pain, and then they start having that bladder dysfunction. So there is therapy out there, and it's just a matter of saying, hey, I'm ready to tackle this and get my body back, get my health back, and move forward.
Even pelvic floor, having a pelvic floor therapist on, that is not something we would like. How long has that been a specialty, and how did you get into this area?
Yeah, so I think it's been around for 20 years, and it's growing, it's expanding, it's like a wildfire. So it's starting to grow and expand. And I think it's because we're starting to talk about it more and we're getting more comfortable. I have 3 children of my own. I had my own pelvic floor dysfunction. And because of that, I was just drawn to wanting to help other women and help everybody just feel better and regain that ability to get back into fitness and feeling better and having our bodies back.
I think drawing the connection between things like back pain and pelvic floor dysfunction is like a great tool of awareness for women out there that have had kind of inexplicable back pain that they just can't find a solution for. So, number one would be to request, you know, access to a pelvic floor specialist. And then once, tell us a little bit about like what would you do with someone that is experiencing back pain, and like what are the things that you do as a specialist to relieve the back pain, to help with incontinence? Like, can you give us, a play by play of like what's a day like with some common modalities that you use with your clients?
Yeah, so part of the therapeutic process is we start with an eval. The eval can take anywhere from 30 minutes up to an hour. And we ask very detailed questions. Like, we want to know everything that's going on. We also just kind of want to know who you are as a person, so we can regain that function, but also improve the quality of life that our folks are dealing with. And so basically, once I gather all the information, I kind of figure out what's going on. We'll do some muscle testing, look at posture, look at the hips, look for different maybe imbalances through the muscular system. We do a lot of education. So education is a big part of what we do. Another session might look like some gentle stretches to kind of help the muscles. We are trained to do internal work, which I believe is sort of the bread and butter of what we do and what makes us so special, because those pelvic floor muscles are internal. And it's not always the most comfortable thing, but it can be a game changer in how people progress and how much better they get. And it can actually alleviate a lot of that pain by doing those internal assessments and getting those muscles to work properly. So that is one component to what we do. It's not something we do every time, and it's not something we have to do. We do have to respect wishes. We also work on some different strengthening techniques, breathing techniques, and then just kind of base it a week by week on how the patients are progressing and what are we missing anything? Are we looking at scar tissue? Are we looking at posture? Are we looking at maybe how you're lifting your baby? How are you lifting that heavy box of cat food, or those sorts of things too? So we really look at the big picture.
Now, you mentioned one that I haven't heard, constipation. You're teaching me something, Jodi. Tell me how that related to pelvic floor, and what do you do about that?
Great question. Constipation is probably the very first thing that I address with everybody that I work with. Constipation is one of those things that actually typically starts in childhood. And then as people get older, it just sort of travels with them and kind of goes through life with them. So we just do a lot of education, educating on fiber, water, exercise. I tell everybody, if you can walk, if you can do something, if you have achy joints, get in the pool. If you can tolerate walking, if you can tolerate the gym and you like it, go to the gym. So working on anything to get those bowels moving. But they live together. They're in the pelvic floor, and then we teach different massage techniques. So it is one of the most important things I think we can do to keep our pelvic floors healthy.
What is the percentage of men and women that you work with?
I work with more women. I think probably for every 20 women, I have maybe one male,
Mhm.
but that's growing. That's getting more common too to see men.
Do you think that women are just more comfortable talking about, the privacy of like the pelvic floor, where men might be a little more reluctant, especially to go to a female therapist? Do you think that's part of it, or do you think that men have not connected the dots that their back pain or constipation or whatever issues they're experiencing could be relieved with pelvic floor therapy?
I think it could be a combination of things. Possibly that they're not quite as comfortable talking about these things. I also just think that a lot of men don't have the same issues as women. Not that they can't have them. Most of the men that we treat have had maybe a prostate type cancer and then their prostate was removed. And that's typically what we're seeing is that sort of issue in men. But I truly think a lot more of women are dealing with these issues because of the pregnancy and the childbirth
Mhm.
process. But men, hopefully, who are having these issues, which they're very important too, can now learn to seek out
Mhm.
help if they need that.
Mhm.
Have, have you noticed in your work that you're, as far as like age wise, I'm sure you deal with women, I hear about pregnancy that you're talking about after pregnancy, post pregnancy, but what about women that are maybe their hormones are changing later in life? Are you seeing, how does that affect the pelvic floor?
Absolutely. And that's another thing too is sometimes after those menopausal years and those hormonal changes, definitely an increase. Sometimes what women will say is, I notice things getting more becoming worse after they've had their menopause starting up. And a lot of times what they'll say is, well, it's been going on for a while, but now it's getting worse. And I would say each decade that we live, those issues become worse. And I think a lot of that is because our muscles are getting weaker too.
So, what can we do to prevent that? We're all about healthy aging. What can we do to prevent pelvic floor dysfunction or atrophy?
Absolutely. I think that the best thing that we can do is talk about it, like in this podcast. I think it's awesome that women and men are starting to talk about these issues more. And I would say if you have even the slightest bit of discomfort or you have the slightest bit of leaking, go ahead and address it while you're young enough. And then that way you get a jump start on it and you can be more proactive and then prevent worsening symptoms or prevent yourself from not being able to do the things that you want to do. And
Mhm.
then, continue aging well. And then you can do that by getting like a referral, from your doctor or whomever to come see a pelvic floor therapist.
If someone has, like my client, getting back to her question, she lifted heavy prior to the birth of her child, and then her son is a little bit older now. I think might be 6 or 7, and she's still not being able. Like she hasn't been able to lift heavy without
Mhm.
intermittent back pain. Do you think that is it possible if you get help with the pelvic floor that you can return to pre-pregnancy exercise with heavy lifting again?
Most likely, yes.
Okay, good. So there's hope, but
Absolutely.
it just takes work with the right therapist and finding what works for you. So what are the things that you can do to strengthen your pelvic floor or to, you know, address those muscles?
That's a good question. My rule of thumb to date has been I don't typically do a whole lot of just blind exercises, if you will, because a lot of times when we do that, we don't necessarily know exactly how the person is doing them. So I really try to because it's a lot about the breathing, the coordination, and making sure those internal muscles, we're treating them to the best of their ability. So a lot of times, what I'll tell people to do is the number one thing is constipation, manage that constipation, drinking plenty of water, and then keeping our nervous system calm. I know we haven't talked about that yet. So I would say before you see a therapist, those are some really important things you can do just to get a jump start on it. So if you enjoy walking, you can do the exercises. You may just, have a little bit of issues, but I wouldn't want anybody to not do anything because of the dysfunction.
Talk a little bit about stress and the pelvic floor, because that is another connection that many people would not make.
Yes. So when we have our nervous system, if we're having a lot of stress or if we're maybe in a stressful time in our life, sometimes what women and men will say is, well, I'm noticing I'm having a little bit more of the leaking, or they may have a little bit more issues with constipation. And on the other end of it, we haven't talked a lot about is a lot of fecal incontinence. So if we're having a whole lot of stress, it can create an exacerbation of whatever those symptoms may be. So if we can calm our stress, some of the techniques I will teach folks is breathing, whatever it is to calm your nerves. So some people like to draw or have an artistic outlet. Some people enjoy reading. Some people, including myself, exercise, whether that's running, walking. I really encourage yoga. I feel like yoga can be really great for the nervous system if that's appropriate for the person. Just whatever the individual enjoys and what's important for them.
And what about sleep? Does that factor in? Is that something we need to think about?
Yes. Yes, I'm glad you brought that up. I do think that sleep is a really big factor. I don't think that it's talked about enough. I don't know that there's a lot of research around sleep. I think that it's probably on the horizon, but as far as it goes, how much it impacts it, I can't give you numbers, but I do believe that if we can get enough sleep, it will help our nervous system, it will help our digestive system. The rest and digest happens here, so definitely get more sleep.
And what about as far as fluid just accumulating? Is that real? And especially, women we're obsessed with our bellies. Me and Shauna talk about this all the time. And fluid accumulation, is that related to pelvic floor? And is there something we can do about that?
Fluid accumulation, that's such an interesting topic. Fluid accumulation, you know, what's the mechanism behind it? What's causing it? So, one of the things that we do in pelvic floor therapy that's once again not really talked about a lot, but if there are scars, like maybe someone's had a cesarean section, if somebody's had their appendix taken out, their gallbladder taken out, or maybe they have like the back surgery, any type of surgery can create adhesions, which makes blood flow, lymphatic drainage, it makes it slow down. So, as a pelvic floor therapist, we do work on breaking up those scar tissues to allow better movement of those fluids. And then, once again, drinking plenty of water and exercising will help to move those fluids along too.
That can be such a game changer. The just releasing the scarring. Can you tell us more about that and that how do you do that as a therapist? What is that like? What does that look like?
It's really kind of a fun technique, and it's one of those on the days of treatments when I do those, it's usually like I'll save that for like a day where I can tell somebody maybe comes in as having a bad day, maybe they're not feeling 100%, or maybe they're just in a very stressful time. So what we do is we just kind of put them in a very relaxed position, usually on their back. I try to make a really calm environment, maybe dim the lights, put on their favorite calming music, and then just teach the breathing techniques and then just different ways that we kind of move the skin and those holding patterns. We can do cupping tools, which can be very nice for breaking up some of those adhesions as well. So a lot of it's just about gentle touch and releasing those scars. And there's more techniques that I'm not trained on, but hopefully down the road, those will become more used in my practice.
I think when people think pelvic floor, the first thing they think is, well, I can just solve it all with Kegels.
Mhm.
And I think that that can actually be countered depending on the person. Maybe I'm wrong.
No, you're right, 100% right. I would say there have been more times I've seen people get better because we stopped doing Kegels. So if you're coming in with more of a tight internal muscles, you have to train those muscles to relax. You have to get them to work in a way that they're going to help you. So when you hear someone say, do Kegels, let's back up a little bit and say, is this really what we need to do? Or maybe we need to approach this from a different angle and really address some other things first. So Kegels are not always the answer.
It sounds like it's a very personalized, not a one size fits all. And, that's why we wanted to talk to you because we're also happy to hear that and see that these are conversations that people are getting more comfortable having. And we want to create the awareness of, women going to talk to their practitioner, seeking out you and other pelvic floor therapists because probably some issues that they have not been able to solve in any other aspect you could help with.
Absolutely. And that's why I think this is such a great and wonderful career and service that we can provide for everybody because it is so specialized. And one of the things that I love so much about what I do is truly getting to know the person who I'm working with and finding out who they are, what they really hope to achieve. And then when they come back, so usually we work with folks maybe once or twice a week, up to 3 months, sometimes longer, sometimes less. But ultimately, at the end of the day, what we truly want is them to come to us and say, I am doing so much better. And now I can run and I'm not hurting, or I can go to the gym and I don't feel like I'm leaking, or I don't feel that pain or that pressure. And so that's really what we try to do is customize it to the person and really focus in on what their needs are.
And when is there a time when it's too late? How old can, or how long can someone have been experiencing these problems and then come to a pelvic floor therapist and get some kind of relief?
That is also kind of one of those things that really depends on the person. I have worked with people of all ages. I've seen people in their 90s who have gotten a little bit better. And it comes down to, once again, the person and how active they are. So that's why I say, even if you are leaking a little bit or having some issues, don't let it stop you, because the more active we are, and y'all know as we age and we want to age health in a healthy way, movement really truly is medicine. But I would say as long as somebody's willing to put the work into it and can tolerate it, we'll try with you. And if it's not the right fit, or if we're not the right program, then we're not going to keep you. If you're not able to do the exercises or the stretches, we'll look at other ways to kind of help you get better. And then there are alternative options for that. I think there are medicines and procedures that can be done, but those can kind of come after maybe the therapeutic approach doesn't work. So will we fix everybody? No, but there is still hope for those folks who can't get better through therapy.
So the physio that you do with clients would be similar to other PT, whereby a client will see you once or twice a week and you'll give them homework, like do these things at home, practice them, and that's kind of how the therapeutic approach works.
Yes, yes. So typically see them once or twice a week. And I always tell my folks each session looks a little bit differently. So the sessions last typically around 45 minutes. And then just try not to overload with too much information, because there is a lot of information. So that's why we kind of say, okay, here's some work, go home, come back in a week, let's see how you're doing. Okay, so this is still what's going on. Let's try this. Go home, try this, and then come back. So we kind of keep building from week to week on what we're doing, with the hopes that it's all starting to come together in a very slow but doable, manageable way with hopefully good results.
And Jodi, you come from an exercise physiology background and then occupational therapy and now this. And it's interesting how you hear the same tie-ins, sleep, lower your stress, get plenty of water, exercise, the same things that, that Shauna and I know are talking to clients about. So what a great expansion for you of your just knowledge base and getting into this realm. And thank you for what you do. And we are so appreciative. And I hope that ladies out there, my wish, I'll go ahead and tell y'all my wish for our listeners is that you all become more aware. Let's talk about it and get the help that you need and reach out to a pelvic floor therapist. What about you, Shauna?
Yeah, it's a great reflection on how powerful small habits like eating enough fiber, getting enough water, moving, all these things, they help with weight loss, with mental health, with pelvic floor health. So it's really interesting that all the small habits really aid to our healthy aging. So my wish is that people adopt those small healthy habits and reap the benefits in a number of aspects of healthy aging. How about you, Jodi? What's your wish for our listeners today?
Well, I just really wish that everybody could experience their highest quality of life, whatever that looks like. And if you are struggling with bowel, bladder, pain, heaviness, or just anything that's pelvic floor related, if you're really struggling, it's okay to talk about it. You're not alone. And just for everybody to talk about it. And if you're needing the therapy services, don't be afraid to ask for it. And just wish everybody good luck with it because it's a great program.
Thanks for listening. You'll find me, Allie, on Instagram at Allie Curve Fitness.
And you'll find me, Shauna, on Instagram at Shauna Kaminsky. Feel free to pop us a DM with questions and or feedback. If you're enjoying the Girls Talk Healthy Aging podcast, please subscribe and share it with other health-minded women. Ratings and reviews are also much appreciated and help us get our message out to a larger audience.
Until next time, be healthy and be happy.